Neonatal mortality rate is the newborns rate, the death rate of newborns per 100 per thousand live births. The Black American neonatal death rate is 3 times the white American neonatal death rate. And white Americans rank 16th after Canada, and Black Americans rank 63 after Cape Verde. Maternal death rates per 100,000 live births of women during pregnancy and childbirth. And what we see here is striking, that Black American death rate is almost 4 times what white American death rate is. And that white Americans rank 30th after New Zealand, and Black Americans rank 56 after Costa Rica, with Barbados and Bahamas having better death rates, significantly better death rates than Black Americans. Finally, I close with the low birth weight newborns, the percent of newborns that are classified as having low birth weight. And what we see is white Americans, once again, 40th after Bahamas, and Black Americans, 123rd after Tanzania. And that Black Americans' low birth rate is almost twice the low birth weight of white Americans. And what is particularly striking here is the countries that Black Americans have that have better health, low birth rate than Black Americans. We're talking about Rwanda, Barbados, Ghana, Uganda, and Tanzania, all relatively poor countries. To understand this, we have to deal with the idea of race versus class. Because at this point, I know that some of you watching this lecture are saying to yourself, well, of course, Black Americans have worse health than white Americans because there are more poor Black people than there are poor white people. That the percentage, not numbers, but the percentage of Blacks, there's a greater percentage of Blacks who are poor than the percentage of whites who are poor. Now the problem with that is that is a class analysis, that looking at poor Blacks and comparing them to middle class Blacks, which is what you do when you say there's more poor Blacks. You're saying that the middle class Blacks are doing better. There would be less disparities if there were more middle class Blacks. And so you're comparing poor Blacks to middle class Blacks. The problem is that's a class analysis. And of course, when you do a class analysis, money makes a difference. Middle class Blacks are doing better than poor Blacks. But that's not the proper analysis. The proper analysis is to compare middle class Blacks to middle class whites and poor Blacks to poor whites. That's a race analysis. That is, when you control for money, how do people of different race compare? And we have data that shows that when you control for money, that health status is still continues to be worse than you would think. One study showed that when you compare low-income whites to low-income blacks, that low-income whites lived 3 years longer. That same study showed that when you compared middle-income whites to middle-income blacks, that middle-income whites are living 10 years longer. That should be raising red flags. What's going on in middle-class blacks' lives that is not going on in middle-class white lives that is causing such a huge age gap, death gap, I'm sorry. Another way to look at this is low birth weight again. And when we look at the low birth weight statistics, we can look at age, years of education as a proxy for class. Less than 12 years of education, and what we see is that blacks are doing worse than whites. 12 years of education, blacks are doing worse than whites. 13 years or more of education, blacks are doing worse than whites. Sure, if we compare less than 12 years of education of blacks to 13 years or more of education for blacks, we see that blacks with less than 12 years of education is doing worse than blacks with 13 years or more of education. But as I said in the previous slide, that is not the appropriate comparison. What is startling here, what is really unimaginable in terms of believing, is that blacks with 13 years of education, 13 years or more of education, are having more low birth weights than whites with less than 12 years of education. That is if you use education as a proxy for income, then what we're saying is middle income blacks have more low birth weight babies than poor whites. And the numbers speak clearly of this. And this dynamic in the health area in particular is repeated. So why the racial health disparities? Well, I hope that what I've done in this short lecture is establish that there is a racial health disparities that is separate and dependent on from class. I will be putting up additional lectures that talk about why the racial health disparities exist, and I hope you take the time to look at them.